Hey guys, Leki here from ProPhysio Plus. Today we're going to be talking about hip pain and why this is important for your daily function and happiness. Please like the video, subscribe to our channel and share with your friends. Let's dive in. Hey guys, have you found that sometimes when you bend over you get this bung hip pain? I'm going to explain why your hip pain may be serious and how you can test for it. But before we do, a good place to start is understanding simple anatomy. Now, what I've got here is your pelvis. And part of your pelvis here is your acetabulum, which is this concave socket. Now, connected to the socket is this ball, which is your femur, part of the femur, which is the top part of your thigh. This ball and socket joint pertains to your hip. Something else to note is within the acetabulum, there's this suction cup, kind of like a plunger, and it's called your labrum. And what it does is it helps suck in the ball within the socket. It gives you a lot of stability. Now, this ball and socket joint has a lot of mobility. So it can move all around 360 pretty much. So with a lot of movement, mobility, you can suffer instability, which we'll talk about. Femoroacetabular impingement, or hip impingement, occurs when there's abnormal bony contact caused by two types of mechanisms. Now, to keep it simple, imagine that the part of the ball is jamming into the socket and it creates changes within the ball, the femoral head. That's called a CAM impingement, C-A-M impingement. That same mechanism may also cause a change in the socket, the acetabulum, and those changes over time is called a pincer impingement. Both cause damage to the labrum, okay, the plunger, the suction, and that may cause damage to the labrum and the underlying cartilage of the hip. Now, hip impingement is a chronic process and it causes gradual degeneration and decay and is a common cause of osteoarthritis of the hip. Okay, the first test is something that may be applied to you if you're seeing a professional who conducts some hip tests. That's number one. Number two, there's some self-tests that you can apply to yourself if you're unsure on what's causing you hip pain. Okay, so if you follow me downstairs here, I've got Avi lying on his back, and a typical test that will be performed by a physio is something called a Faber's test. The acronym stands for flexion, abduction, and external rotation. So basically we're testing some structures around the hip, namely your hip muscles, okay? Now an easy way to do this is to rest your foot on the opposite knee and just allow the knee to fall to the ground, and you can take note on how far Avi's hip or your hip falls to the floor. Now that's one simple self-test you can apply. You can then compare that to the other side, same thing, bend your knee, and that movement Faber gives us an idea on Avi's hip range. Okay, second test is you can self-assess by bringing your knee to your chest and you can push yourself. So if Avi was to grab his shin and he pushes his knee up towards his chest, he's getting good hip flexion. And if he gets to the end and it doesn't reproduce your hip pain, that's a pretty good sign. Let's say you get to the end of your hip bending and then you bring it across the midline, okay, and then you're starting to reproduce some of your pain. That's something to note, okay? And then what you can do, which is a bit tricky, is if you can sort of push your foot outward, it gives you more of a wind up of the ball within the socket, and that can give you a good idea of your hip health, okay? So that's a good self-test to apply. Okay guys, I'm about to walk you through some key exercises that I commonly prescribe to everyday people just like you and me in the clinic. Now what's important is this is very individualized. So this is a good place to start if you're starting some rehabilitation because your pain's pretty nasty, or it's a good place to prepare your body if you're looking to go and lift heavy weights in the gym or perform a sport, okay? So always be mindful that when you are performing exercises that you get the right advice. Now, if you follow me down here to where Avi's previously set up, now Avi's a young, fit, sprightly fella, and what we've got is a resistance band around his knees. Now, there's different types of resistance bands and they give you different pushback, so depending on how strong you are, you can just apply the right force. Now, exercise number one that I like to prescribe face down, this is really handy because your back is happy, you're in this position called neutral spine, and it really is a good place to start because it targets some of the key muscles that actions directly into your hip. Now, the first exercise I'm going to teach you is called a prone clam. So in this position, I'm going to ask you to bend both your knees, and if you can keep equal pressure around your heel and your toes, it just puts some good mechanics about the hip. So equal pressure, and as you're sustaining that, I'm going to get you to open your knees apart for me, please, Avi. And then you try and go as wide as you can and return to the midline slowly, nice and easy. Keep repeating that for me, please, Avi. Now, what you're doing here is you're going into a clamming movement. Okay, and if you're doing this properly, you should feel the work deep in your meaty backside. And I like performing this exercise a certain number of reps and sets. I tend to start quite low and then build endurance over time. So a good place to start perhaps is 2 lots of 10. If you find that's pretty easy, start to increase as you go. Okay, that's exercise number 1. Okay, the second exercise I like to give is, it's a hip extension exercise. So same position, back still quite happy. You can see that the shoulder, hip, knee is one straight line, so neutral spine, we like that. And I'm going to get you to pop your hands under the front of your hips for me, please, Avi. Okay, now what I'm going to get Avi to do is I'm basically going to get him to raise his leg up towards the roof. But what's important is that he doesn't raise his hip away from his hand. So we don't want him to trick and use other movements. We really want to try and isolate the key movements, which is mostly about his backside. So if I get Avi to bend his knee, that's it. And Avi, I'm going to get you to raise your knee up off the ground as best you can, good, without lifting your hip away from your hand. And just repeat that movement. Perfect. And what we're doing here is we're trying to activate these deep hip muscles that help deload his hip. Okay, good exercise there. Okay, the third exercise I commonly give for hip pain is, again, in this prone, lying down on your tummy position. I'm going to get you to open your legs out to the side as far as you can and then come back to the midline. Good. So coming back to the middle, as Avi continues to perform this exercise, you can see he's not looking to lift his legs up off the ground. His toes are hooked down into this position. And that's just really good mechanics to get as much work in the hips there. So there's nowhere to hide. It has to do the work. These series of exercises have been modified from the McGill method. And big shout out to Professor Stuart McGill and to Dr. Andrew Locke for giving us a foundation and a framework to persist in helping our community.
Hi guys, it's Avi and Leki here. So this is a quick fire questions on hip pain.
All right, here we go.
So what are the signs of hip problems?
There's a lot of signs, but the primary symptom that's associated with hip impingement is the gradual onset and progression of pain on one side. It could be in the groin, that's mostly where it is, I'd say 80% of the times in the groin, and it could be aching or sharp pain, most commonly both. The pain location isn't restricted just to the groin. Sometimes it can be in the upper outside edge of your thigh and even out towards the backside.
The second question I have for you is walking good for hip pain?
We would never discourage walking for hip pain. And what I'd like to point you towards is a great resource within the McGill method in his book, The Back Mechanic. Professor Stuart McGill talks about pain, position, and posture. We're looking at maintaining something called spinal hygiene, which is a happy spine. We're looking at positions throughout the day that cause you your pain. And if you modify your position and your posture, it'll help you in reducing your pain. Okay, very important. So walking, if you're finding that, say, 5 steps is giving you pain, that's your barrier, then start there. And then over time, as you persist, 5 steps becomes 10 steps, becomes 10 minutes, becomes 10 Ks. So start where it's most comfortable for you and then push forward.
All right, another great question. So how can I get rid of hip pain?
A great place to start is seeing your local professional, and seeing your physiotherapist as a first-line provider is a great place to start. You don't need a referral to go see your local friendly physio. The underlying causes to what's causing your pain is a great place to start in understanding your hip pain. And this is essential in determining your specific customized treatment approach. Everybody is different. We're putting our bodies through different environments, so you've got to get specific advice for your problem. Now, as you're getting the help from your physiotherapist, we may engage other people to assist you. It may be your local doctor. It may be sending you off for another opinion, as in a specialist, or further imaging. This all helps in ensuring that your hip is under control and that it gets happy again.
Okay. Next question. When should I go to the doctor for hip pain?
This is a very common question that we get in the clinic. Sometimes people come and see us for their first assessment of the hip, and they're already thinking about escalating things. And we completely understand. We all are very human. We understand pain is painful. Sometimes though, we need to give you a chance to get on top of your hip pain, and it can be starting with some simple education, understanding things like your anatomy, things that may cause the triggers for your pain. And then we start with some progressive exercise, which I hope you've learnt with our videos. And then at that point, we can then determine if we need more help. So always give yourself the benefit of the doubt. And if you've got great education, great exercise, and we're addressing some lifestyle factors, I think that's a good place to start. So there you have it, guys. We've laid out why hip pain is something you should get on top of straight away so you can enjoy your best day. Please like the video and let us know how you went. Subscribe to our channel and share with your friends. We'll see you next time, and as always, making healthy simple.